Hi everybody, my name is Nicole, and in this video I'm going to be talking about bulimia nervosa. There are several different criteria that one must meet in order to be diagnosed with bulimia. The first is that the person must have recurrent episodes of binge eating, and within those episodes of binge eating they must be characterized by both of the following. The person must eat a significant amount of food within a certain time frame, and that amount of food is significantly larger than what most people can consume within that time frame. The second is a sense of lack of control over eating during the episode of binge eating. A person may feel that they can't stop eating or really control how much they're eating during a binge eating episode. The second criteria is recurrent inappropriate behaviors in order to prevent weight gain. They can be very similar to what I talked about during the anorexia video: self-induced vomiting, the misuse of laxatives, diuretics, or enemas as a way to lose weight, fasting, and excessive exercise are also recurrent inappropriate behaviors that a person with bulimia might suffer from. The third diagnostic criteria is that the binge eating and inappropriate behaviors must both occur on average at least once a week for 3 months. The behaviors can certainly occur more than that, but on average it has to be at least once a week for 3 months. The fourth diagnostic criteria is that the person's self-evaluation is influenced by their body shape and weight. And the last criteria for bulimia is that the disturbance does not occur exclusively during episodes of anorexia nervosa. They can certainly occur together, but bulimia can also occur separately from anorexia. There are several different levels of severity of bulimia: mild, moderate, severe, and extreme, and they are based on the frequency per week of the inappropriate behaviors that I talked about. Usually when people think of bulimia, they associate it with binge eating, and binge eating does certainly occur and has to occur to be diagnosed with bulimia within that certain time frame. And usually the time frame is less than 2 hours. However, a single episode of binge eating doesn't have to occur just at one place. For example, a person could go to a restaurant and start binge eating there, and then come home and continue binge eating, and it could still fall within that 2-hour time frame and be considered a binge eating episode. Individuals with bulimia are typically within the normal weight or overweight range based on the body mass index. The disorder can occur in people who are considered obese, though it is less common. Women may experience menstrual irregularity or the lack of a menstrual cycle if they suffer from bulimia. Other physical health issues can arise, such as esophageal tears, gastric ruptures, and cardiac arrhythmias. The most common symptoms are gastrointestinal due to the constant purging that can occur from bulimia. According to 2 different studies that have been done in the United States, the prevalence of anorexia ranges from 0.14% to 0.3%. It occurs predominantly in nations that are post-industrialized and higher income, such as the United States, Canada, a lot of European countries. There is prevalence of bulimia in some regions of Latin America and the Middle East, but predominantly in the higher income post-industrialized countries. Like anorexia, bulimia typically begins in adolescence or young adulthood. Onset before puberty or after the age of 40 is pretty uncommon, though it does happen. Sometimes people may experience stressful life events that may trigger the onset of bulimia, and there is an elevated risk of suicide with bulimia. There can be a diagnostic crossover, so somebody may start out as being diagnosed as bulimic, but they may transfer into more of anorexia nervosa, and that occurs in about 10 to 15% of cases. People who do experience this crossover between both diagnoses kind of flip-flop back and forth, but typically will always revert back to bulimia. There are different risk factors for people developing bulimia. These can include low self-esteem and depressive symptoms, childhood anxiety, people who experience childhood sexual or physical abuse are at an increased risk of developing bulimia. There is a genetic component too. People who have family members who suffer from bulimia may be more predisposed to developing bulimia themselves. The internalization of a thin body has been found to kind of increase the risk for developing weight concerns, which may in turn increase the risk for bulimia. I know social media and idealizing celebrities and the typical thin body can also kind of be a contributing factor to people developing eating disorders. Like with anorexia, bulimia typically occurs in girls and women, though it does occur in boys and men. It's just less common. There is an increased risk of suicide with bulimia. About 1/4 to 1/3 of people with bulimia have suicidal ideations, and about 1/4 to 1/3 have attempted suicide. There are a risk of comorbidity with bulimia. Most people with bulimia experience at least one other mental disorder, but there's an increased risk of developing other mental disorders too. Really, bulimia can affect people socially. They may be more withdrawn, and this can be due to the guilt and shame that they feel from the behaviors that they partake in, like purging, and can really affect them socially.